Okay, so our next speaker is Dr. Abhijit Solanke. He's a new generation of surgeons who are embracing technology to deliver good outcomes for his patients. So look forward to hearing his views.
Thank you, sir. Thanks to BOS, Professor Tolat sir, Garg sir, Bajaj sir, Sanjeev sir. So thanks for the opportunity. I bit disagree with Alam sir and sir said that cost is an issue. We are not always a slumdog millionaires. So we are Mr. Amitabh Bachchan who has overcome everything. So all work has been done at a government center. So things can be done. So we do all the things what sir said, but something new things we can adapt. So thanks to sir for hosting us, and thanks to consider me to be a part of this esteemed gathering. So no financial disclosures. There are a few patents which I got with my team. This is the government center which I work. It's India's biggest cancer hospital. It's a government cancer hospital. It's a 1,000-bedded cancer center. So it's a high-volume center. So we are now Aaj, Kal and Kal. So we are done amputations. We are doing still amputations. A week I do at least 1 or 2 amputations. But still the salvage rate is around 80-90%. So, yes, sir. So we'll be seeing these new things. It's virtual reality, augmented reality, 3D printing and AI, which has significantly helped us. Previously, we used to go to the grocery shop to buy any object or anything. So still we go, but that is decreased here and in India and all over the world. So just we have Amazon, Zomato, Swiggy, multiple things. So what is the future? If you want to buy a pair of shoes, just take your phone and scan it and use augmented reality, virtual reality, give the printer order, and it will give you the perfect precise shoes. So like the custom-made suit, what we wear, or a ready-made suit that we have. So both options we have, and we have moved to this currently. So are we becoming God? We really don't know. So this is the algorithm what we follow. So we get a X-ray, MRI, CT scan done. We make a computer-aided model. We do all virtual planning of the surgeries. So like India going to Australia or England, they do match practice before the surgery. So similarly, we can do all the plannings before the surgery, which will improve the outcomes. We get the implant model. We print either the model or the jigs. So this is a small video. So we have multiple options available to buy the shoes and everything. So you scan your shoes and do all the things. So this is how the 3D printing technology works. So you put a filament into it, and like the insect making cocoon around himself. So you can put a plastic filament, it will print plastic. You print a metal, it will print the metal object. So this is my simple 3D printer where I'm printing Ganeshji's idol, Dagdushet Halwai's idol. So I have a STL file, which is for 3D printer. So just I give the command to it and it will print the object. So it just takes 15 minutes, half an hour. So if you are busy in your practice, you want to show the patient osteoarthritis of his knee. So just you upload the CT scan and it can print for you. So this is just a simple 1 inch by 1 inch knee model. Just it takes 10 minutes to print. So you can explain to your patient, you are having osteoarthritis, you are having the disease, what you are having. So just it's a 1 inch by 1 inch model, 10 minutes to print it. My kid prints it at home. So it's very easy procedure. So how we use in our surgical planning. So this is the diaphyseal defect. We'll be treating with ECRT. So this is the model. You explain the patient. We'll remove the bone from this part to this part. And we'll send it to radiation, liquid nitrogen, fibula, whatever you want. And you practice all the steps before the surgery. How much steps plan will be the cut. Second, we go to a virtual guide model. So this is the femur bone. We will print this is the tumor bone. This is the normal bone. And we have printed a 3D printed titanium plate. We can appreciate a few parts are solid and few are with holes. So that the strength is very good. And you practice all the steps. How much is the length of the screw, where you will be putting the screws, how much far is your joint. It's a customized plate. It just precises perfectly cis. So this is pedicle liquid nitrogen, put the bone in nitrogen. It's minus 180 degree for 20 minutes and put the bone back again. So very easy, use the patient's own bone. Your plate just slides here. You don't have to do any contouring or anything required here. So this is the second use of 3D printed plate. So we saw the model, then the plate can be used. Next is 3D printed talus. So multiple options available. We have done orthodesis, we have done fibula. All options have been tried. So this is a new technology what we are using. And remove the tumor, put the talus. So few designs we have made where this is only talus. We have made a base plate for it and our own designs we are using. So it's nearly 5 years plus follow-up of these cases. So we have options available, curettage, spacer, orthodesis, everything. Like Indian team has multiple bowlers or batsmen to use. So this is the model, what we print. We take the cuts. We use a second design where a base plate is used. It's an uncemented implant, which is designed by our team. We put screws here. So we intended to put 2 screws, but it was a bone where you require a flexible drill bit. So we didn't have that. So we learn from our own mistakes from these cases. So this is the implant where a base plate, metal, poly and metal, which was used. This was the first X-ray. This was the follow-up X-rays. And this was the function of the patient. Next we go to metacarpal hand implant. So here we have multiple options. We have tried metatarsal, fibula, multiple options can be tried. So here we design our own implant, which is a honeycomb lattice pattern. Your poly material is there. And this was the tumor. We get the CT scan done. Again, this man is troubling the world. He is in UK. So we can have multiple friends. Multiple options are always available. So we have used all the options. So we have gone to this, and it's Modiji's birthday today. So this is the planning how we do, my fellows, and we write all the plans, what we want to do. So very well planned. Every case is very well planned. We remove the tumor. This is the implant, what was designed. It's a poly material here. We remove the tumor. We can appreciate here multiple holes are made so that you can make the capsule here. So in initial cases, it was getting dislocated. So later on, we understood that multiple holes, multiple directions, and we do get finite element analysis done. So you can say that a solid implant will be better. So that we have analyzed in our subsequent journey that lattice structure works same and all the computer design helps. Like sir said, the physical model to break and plate the implant, that is not possible. So computer analysis is done here. So we use here PET material. This is polyether teraphtite. It is by Mutas to make the capsule here. This is how the capsule was reconstructed. This was first X-ray. This is the clinical picture. This is the follow-up. This is the function. And if we can appreciate it is stable here. So it's a good technique to use. You can use 3D printed metacarpal for reconstruction. This was the function. She wrote India. Next, we had 3D printed scapula. Again, we have multiple designs. It's partial scapula, total scapula, scapula with reverse shoulder. Again, it's a here lattice structure. This is the tumor model. One design, second design, and this is the thing to explain. Again, we use multiple materials. Your capsule is reconstructed, and this is artificial ligament material can be used. Next, we go to virtual reality and augmented reality. So this is really new, fascinating world which can be useful for training purpose. So if you want to explain your patient what is bone biopsy, you can explain virtually or orally. We can write on a pen or paper. So how this helps for us? So a small video. So routinely we do this as very common procedure, bone biopsy. So first step is giving local anesthesia, screwing movement, get the tumor cells, and send to the pathologist, 5 steps. So this is how, if you explain the patient this way, he'll not feel that good, that you're poking your bone, and it will be painful for me. So this is how we send the pathologist specimen, chai ki channi mein dal ke. So this is a simple thing, what can be used again. So these are the steps. We made our own softwares so that the patient can be explained. He wears the glasses, he does all the steps. So he first picks the thing, local anesthesia he can give. It's like playing a video game, PlayStation game. So we use Oculus glasses that are available with us. And we are trying to compare the analysis. We have sent this for publication. It is under review. So this can be a good training purpose. So if you want to train your residents, how is the bone biopsy done? He can do all the steps. So that is a very easy training module. So next we go to how we plan the augmented reality cases. So we remove the scapula here, and 3D printed scapula will be designed. Your virtual planning is done. This is the implant, one more design. So it's like the Jarvis. Iron Man is wearing his glasses. I can see all the X-ray MRI in front of my eyes. I can superimpose it if I want to take help of Tolat sir here. Sir is wearing the glasses, I am wearing the glasses. And sir can guide me for this case. So I don't have to call sir to India. So it will be costly affair for me. So just sir wears the glasses and sir can guide me. So here we can appreciate here I am superimposing the object over the object. So it's like making a Google map of a surgery where your artery is, vein is, nerve is, it's always in front of your eyes. You can enlarge it, superimpose it. Your X-ray MRI always in front of your eyes. So you don't have to see on the viewing box and just you can superimpose. So we have tried this for, this is the case, 3D printed scapula. So if this, we have tried for liver cancer cases. So they can do partial. This is a total femur expandable case. Again, we use here augmented reality. We remove the tumor and this part will grow. It's an indigenous implant. It's a screwdriver mechanism. So you remove the tumor and this part will grow. So every year the kid is called, you turn few threads and the limb will grow for this patient. So this is the tumor. You remove the tumors. And this is the growing joint which will be placed. This is the growing part. So a screwdriver is placed here and we can appreciate this part is growing. So it's a minimally invasive, maximally means non-invasive is designed by Stanmore. It's too costly, so can't be used for our patient. So I agree here with Shah Alam sir that we need to innovate our own things. So everything can't be copied from the Western world. But we need to show the Western world that we are doing at par or better work as compared to anyone else. So this is how we superimpose the thing using the augmented reality, and this part will grow. So this is the latest thing what we are using, PEEK material, polyether ether ketone. It's a chiron fiber material. You must have seen Mr. India movie by Anil Kapoor or Invisible Man. So if we put this implant, it will be not seen on the X-ray. So we have tried the plates and the implants. The advantage here is if you want to go reassess the patient on CT scan and MRI, you can assess it very easily. So if the fracture is there on the osteotomy site, your assessment becomes very easy. There is no metal scattering here. So this was a case where a scapula is removed, where you put this implant, and it's not seen on the X-ray. So what is the future? Bioabsorbable scaffolds, like Sir has shown, we are using this tricalcium phosphate material. And this is a customized plate, and the scaffold was placed here. So we are working on it for the last 2 years. Next is what Modi says, made in India. So everything is made in India. Previously, we took help of Israel or other countries. For the last 10 years, we are using our own things for this. So this is the latest thing I want to show. This is traditional biopsy device. We have got our own biopsy device. So we got the patent of this. We are a good team of engineers with me. And now we are working on a robotic arm. So if you invite me next year, I should be ready with this. This is the team of engineers. And this is a small video. Last 2 slides. Sir. So it based on 2 mechanisms. Sensors are there, which will know where the bone is. So it will not go beyond that cortex. So it has distance, depth, and pressure sensor. So the needle will stop automatically here, outer cortex. So that is the patented technology. And lastly, there is life with or without hands. So this is last video. So we are working on AI for last around 9 years. We have published 2 of our scoring systems. One is A to Z, RAM, and REST. So we can put the X-ray into the computer and it will tell it's benign or malignant. So the software is nearly ready. So we need to draw the borders. So this can be drawn. So it's a benign tumor most probably. The software will tell you it's benign or malignant, and a scoring system is done. So we need to respect the borders. Malignant tumors don't follow the borders, like India-Pakistan border on C or India-Sri Lanka border on C. So here they don't follow the borders. So on this AI we are working. And lastly, we have devised our own hand, which is myoelectric hand. Like Jaipur hand, we got inspired. We titled it as A hand or Ahmedabad hand. So it is having its own mechanism. Sensors will be on the fingers, so it can know it's a glass material or it's what type of material, and it will apply the pressure accordingly. So that we are working. So just we have applied the patent of this. One of our patient in which myoelectric hand was applied. So lady where amputation was done from this part, and the person needs to think from his brain. The signal goes from brain to the muscles, muscle to the skin, and this part works. Lastly, my amputation, or rotational plasty. This is one of my favorite surgery. So your ankle joint works like a new knee joint. So it's excellent procedure, cosmetically not that great, but this is a patient where amputation was done, and we can appreciate here, he walks very well. It's cosmetically not that great. So if this ankle is turned upside down, one sneeze, rotation plasty. And lastly, I will show Krukenberg hand. So there is life with or without hands. Here there is no ulna bone. So all bones are required in the body, no. We have placed the radius in the capitular, radiocapitular joint. So are really all the bones required in the body? I don't agree. And lastly, the Krukenberg hand. So still we are doing all the procedures. It's not that we are using latest technology. This is just done few months back. So all procedures are equally respected. You need to give excellent outcome to the patients. And what is the future? At present, we are printing bones. In future, can we print? Yes, we can print muscle, nerve, artery, vein, or anything. So thank you very much, sir.
Okay.
I think we yeah. I
We
think
might just move on to
We-
the
yeah.
next topic.
Thank you, sir.
Okay, thank
we've
you.
already ordered. Thank you.